breast carcinoma. It is mostly prevalent in the female gender and rarely in males. The breast of females consist of milk producing glands and milk carrying ducts called as lobules and the ducts. There is an external aperture nipple, and around that there is areola, overlying skin. Inside the mass of the breast there is connective tissues, blood vessels, lymph nodes. These are the anatomy of the breast. There are two types of carcinoma. Most prevalent is, that is 95%, that is the ductal carcinoma, while the remaining is called as lobular carcinoma, arising from the lobes or the milk producing glands. Etiology: still unknown. Age factor: above 40, near menopause. Excessive use of alcohol, traumatic injury, excessive use of hormone therapy, chemotherapy or radiotherapy. There is familial predisposition, genetic mutation, and also it may appear in younger ages due to multiple sex partner and pinching of the frequent pinching and hardly pinching the breast. Symptoms of the carcinoma: there is lump, tenderness, pain, bloody and milky discharge from the nipples, nausea, vomiting, anorexia, malaise, jaundice, anemia, RBC count falls. There is also chronic cough with blood stain, phlegm, chest pain, atelectasis and pleural effusion. When it spread to the brain tissue, produces the neurological complications and symptoms, seizure, convulsions and other neurological complexes, peripheral neuropathy. There is damage to the nerves and the neurons. Diagnosis of the carcinoma: plain X-ray of the chest, MRI, ultrasonography of the breast mass, CT scan, mammography, which is most diagnostic one, to take the series of the X-rays by this machine. Then there is needle aspiration and biopsy taken to the lab for cytological study, where the types and the grade and stages of the carcinoma is finalized. Now, treatment of the carcinoma: medical treatment, chemotherapy, targeted therapy, immunotherapy, biologics, and there is a radiotherapy from external or internal methods and processes. Next is the final option is surgical manipulations. Lumpectomy, removal of the lump of the nodes, mass which is formed within the breast tissue, and the sparing the normal tissue of the breast. When the carcinoma has spread throughout the mass of the breast tissue, then whole of the breast is excised and dissected out by surgery called as total open mastectomy. Because it has to save the life of the patient. In addition to this, there is also a surgical procedure called as prophylactic mastectomy. When by the diagnostic test it is detected that there is familial predisposition in the person, in the females, towards the breast cancer. So to save the life of the female, we adopt this surgical procedure, bilateral total mastectomy. This is the only final and effective manner to save the life of the